Welcome to Alivio Medical Center. My name is Dr. Anthony Hillebrand. Today I figured I'd discuss more in depth the direct access model for physical therapy. Direct access, what does that mean? That means you can walk in off the street and see a physical therapist. You don't necessarily have to have a doctor's order to begin with. Why is this beneficial? In our current state with the COVID-19 virus, it's advantageous because you don't have to go to the doctor's office. You don't have to wait in a waiting room full of sick people. You can get seen quicker versus if you go, you have to make an appointment with the doctor, you have to see the doctor, then you have to make an appointment with the therapy clinic, and then you get to go have your appointment. That process these days can take anywhere from a couple of days to a week to maybe 3 weeks. And some outpatient clinics aren't even open, particularly the ones attached to the hospital because they're pulling that staff to help out at the hospital. So, why should you come see us for direct access? First and foremost, from a cost standpoint, we are probably, if not the most affordable, one of the most affordable therapy clinics. Both in the fact that our per visit cost typically is less than other clinics, and our time from start to finish, i.e. time you get evaluated to the time you feel better and you're done with therapy, tends to be quicker. Large portion of that is due to, because it's just me, I'm not tied to a larger corporate structure, then I don't have to keep you, if your plan approves 30 visits, I don't have to keep you for the 30 visits if you're good after 10 visits, because I'm not having to pay for administration and corporate costs associated with that. So that is a benefit. So you'll save money. I get people in sooner. I typically, if a patient is willing, I can see them sometimes as quickly as same day. If not within 48 hours. We try to keep that, though, 24 hours or less. And I would say 90% of our patients are that 24 hours or less. So it's to your advantage. Now, with the state of Indiana, they give us 45 days to see before we have to involve the doctor. Now, if you have something major, we're going to involve the doctor a whole lot sooner. But if it's just, your mild sprain, strain, low back pain, knee pain, etc., then, within 45 days, we should have you better. Most of my patients on average are 8 to 10 visits for back pain. For knee pain, depending on the cause, 7 to 10. For dizziness, that's typically 3 to 4 visits. So if it's concussion rehab, I'd say about 6 to 10 visits depending on the severity. And I have no problem discussing how long it takes me to get people better, with the caveat is this is historical numbers. Now there's a range always in there. Where I've had some back pain patients better in as little as 4 or 5 visits. I've had some back pain patients who, because of other issues going on and not the greatest about doing their homework, it might take 12 to 15 visits. But I would say on average, if you come see me for back pain, you're probably looking at 8 to 10 visits, especially if you're good about doing your homework. And we'll discuss this your first visit. So I'll give you a pretty good idea based on what your symptoms are, how long you've had your symptoms, all of that, roughly how long I think it's going to take to get you better if everything goes according to plan. Not to say if you're better sooner, you'd be done sooner. If it takes a little longer, it takes a little longer, but we're going to have that honest upfront conversation to start with. So if you have any questions, you can give us a call here at Alivio Medical Center. Our number is 317-635-3499. Once again, that's 317-635-3499, extension 3. That'll get you to either myself or Patricia, and we will get you set up on the schedule. And like I said, most of our appointments happen in less than 24 hours, and we will go from there. So thank you very much, and I hope to talk to you soon.